Acute inflammation mechanisms, effects, and management. Acute inflammation is a natural and necessary response by the body to tissue injury. This injury can be caused by a variety of factors including mechanisms of acute inflammation. Vasodilation. Chemical mediators cause vasodilation, leading to increased blood flow to the injured area. This is why inflamed areas often appear red and warm. Mechanisms of acute inflammation. Increased vascular permeability. Chemical mediators increase the permeability of blood vessels, resulting in leakage of fluid and protein from the blood into the interstitial tissue, causing swelling, edema. Mechanisms of acute inflammation. Leukocyte recruitment. Neutrophils are the first type of white blood cell to migrate to the injured site, where they are responsible for killing bacteria and other pathogens. Phagocytosis. Neutrophils engulf and destroy pathogens. Mechanisms of acute inflammation. Release of chemical mediators. Neutrophils release chemical mediators that amplify inflammation and recruit other cells to the site. 4 cardinal signs of acute inflammation. Redness, rubor due to vasodilation and increased blood flow. Swelling, tumor due to accumulation of fluid and protein in the interstitial tissue. Heat, calor due to increased blood flow. Pain, dolor due to stimulation of nerve endings by chemical mediators. Systemic effects of acute inflammation. Fever caused by the action of chemical mediators like interleukin-1, IL-1 and TNF-alpha on the thermoregulatory center in the brain. Acute phase response. Changes in white blood cell count, erythrocyte sedimentation rate, and plasma proteins. Systemic effects of acute inflammation. Changes in sensation, fatigue, loss of appetite, muscle aches. Management of acute inflammation. Symptom management, providing pain relief, fever reduction, and reducing swelling. Treatment of the underlying cause, addressing the source of inflammation, such as eliminating infection, removing allergens, etc. Support for recovery. A nutritious diet, adequate rest, and physical therapy. Important notes. Acute inflammation is a necessary response to protect the body from injury. However, if acute inflammation is not treated promptly, it can lead to serious complications such as sepsis, septic shock, etc. Chronic inflammation is a prolonged inflammatory state that can cause permanent tissue damage. Conclusion. Acute inflammation is a crucial part of the body's immune system, helping to defend against injury. Prompt and effective management of acute inflammation helps minimize the risk of complications and accelerates recovery.